Almost 21 million Americans aged 25 or older have osteoarthritis. We spoke with Dr. Ramin Pooyan at Desert Regional Medical Center in Palm Springs, who tells us more on osteoarthritis and the hand.
But if we talk about osteoarthritis, that's basically a degeneration of the joints, and specifically in the hand, we're talking about the fingers, the wrist. Basically, when the cartilage is wore down, the bone starts rubbing on the bone, and that causes severe pain and discomfort for the patients.
What can cause osteoarthritis?
If you divide it into post-traumatic versus degenerative, in terms of post-traumatic, injuries can cause arthritis in the hand. So any kind of trauma, fractures in the joints, that can cause post-traumatic osteoarthritis. And then the second category are mostly elderly patients that have degeneration of the joints that cause osteoarthritis. There's different degrees of it. There's early stages where we can offer some conservative treatments, splinting and injections and anti-inflammatories. But once the arthritis progresses to the point where there's very little cartilage left, then we have to talk about surgical options. And there's different techniques and methods we can use to help the patients. Depending on the injuries in the fingers, sometimes they might need fusion of the joints that have arthritis, or also replacement of those joints. It's really specific to the joint we're talking about.
Can osteoarthritis be genetic?
There's been some studies that show there could be some genetic predisposition to people developing osteoarthritis. And we actually see it very commonly in the base of the thumb, which is called basal joint osteoarthritis, more common in females than males. And actually the procedure for the basal joint arthritis is one of the most successful procedures that we can offer the patients. It's 99% success rate for most patients. Again, return back to function, especially if it's their dominant hand, which most of the time it is. They're able to go back to daily activities, opening jars, which is very difficult for patients who have these type of arthritis.
Is there a cure for osteoarthritis?
The problem with osteoarthritis, it's a progressive degenerative disease, so there's really no cure. I mean, it's inevitable that patients are going to need surgery at some point. But we like to delay that process until we have exhausted all conservative treatments. But I think eventually most patients will need some sort of surgical intervention.
Have there been breakthroughs that could help someone with osteoarthritis of the hand?
There is a disease process called Dupuytren's contracture of the hand, and actually recently there's been some new drugs that come on the market. It's basically an enzyme that's used to inject to help basically release these tight bands or contractures in the hand. That's actually one of the newest medicines on the market. It's very interesting. It's actually an enzyme that's produced by bacteria that breaks down collagen. And the disease process involves a hypertrophy of the collagen within the palmar fascia of the hand, and the enzyme helps break it down. And so it's a minimally invasive injection that we can offer the patients.